this section. And again, I'm going to read the language. No federal, state, or local law or rule shall prohibit the purchase or sale of health care or health insurance. No federal, state, or local law or rule shall impose a penalty or fine for the sale of or purchase of health care or health insurance. So let's talk about some very important current prohibitions that the state places on the sale of health care or health insurance. First, medical licensing. We do, in fact, prohibit certain providers from providing health care. And that's a good thing because it maintains quality, it assures quality. There are licensing provisions in Ohio Revised Code to make sure that the type of health care that we get is quality health care and that bad actors are not, in fact, providing that health care. So as you can imagine, this would essentially make unconstitutional a lot of the medical licensing that we are doing now in the state of Ohio. And again, because a lot of that Ohio Revised Code and the Administrative Code have enforced that, we have issues around rules being updated as well. And one of the most concerning ones is the fact that the Department of Insurance does prohibit the sale of health insurance today. There are policy guidelines, most of them found in Ohio Administrative Code, so a rule. There are policy guidelines that spell out what type of insurance policies can be sold in Ohio, minimum requirements, who can sell those insurance policies. And this is one where, as recently as the spring and early summer of 2010, the rules, and as a result of HB 300 that passed in February of 2010, the rules regarding licensure of insurance agents were just very recently updated. And so that's another example of one that would be thrown out immediately. We wouldn't have to wait till getting around to, well, what if it's changed? That would be those rules that are currently in place to enforce insurance agent licensure would be unconstitutional from the beginning. So again, those are several of the items listed in our report that we wanted to highlight. There's also an exception clause, and this is where I'm going to ask the professors to talk about the exception clause, because I think a lot of people will point to that exception clause and say, oh, this doesn't really have that much of an effect. A lot of things that you're talking about are exempted, but that is very much not the case. And so at this time, I'd like to turn it over to Professor Hill and Professor Mehlman to talk about the problems that arise when you start looking at the actual wording of the exception language.
Thank you. Yes, as Janetta said, there is this section 21D in the proposed amendment that purports to accept or exempt a large number of regulations and laws from the prohibitions that Janetta was just talking about. So what sorts of laws would actually be exempt from this amendment? Well, first of all, the first problem is that it's not entirely clear. But let me just reiterate that there is this grandfathering provision that purports to exempt any laws in place as of March 19th, 2010. So it suggests that any laws already in effect would not be affected by this constitutional amendment. However, that's problematic for a lot of reasons, not the least of all, which is what Janetta said, that first of all, agencies at a minimum are required to review and update their rules every 5 years. So that requirement of updating and reviewing agency rules would become essentially meaningless with respect to anything that is affected by this amendment. Of course, just in general, it would freeze many important laws affecting healthcare in time, essentially, as of March 2010, which, if you think about it, is really problematic in the context of the changing state of medicine and the healthcare industry, to think that no federal, state, or local laws could update or change anything that was in effect in 2010. Right, that couldn't be updated after 2010.
For example, if a new infectious disease burst on the scene, a new avian flu or a new form of tuberculosis, and the state health department wanted to find out how many people are being affected and how that disease is spreading, they would have to change the rules that now require reporting of infectious diseases to add that one, and that would be called into question by this constitutional amendment, because it would be a rule that would be put into effect after 2010.
And if there was a new vaccine for that new influenza, same set of problems would occur. In addition, the other seemingly important exemption here is for laws calculated to deter fraud or punish wrongdoing in the healthcare industry. That seems like it could be significant. However, first of all, nowhere in the proposed language is the term wrongdoing defined, and that's not a legal term of art. So it's unclear what is meant by a law that's aimed at deterring fraud or particularly punishing wrongdoing. It could mean criminal laws, for example. Really, in some sense, all laws are aimed at deterring wrongdoing as defined by the law. So it's unclear. They can't mean to exempt all laws. So it's unclear what that exemption even means. And as Janetta mentioned, that's likely to spur an enormous amount of litigation. In addition, something like, as an example, the pill mills legislation that Janetta talked about, certainly, as we discussed, the reporting requirements under that law would be unconstitutional under Issue 3, but it's not clear whether even all the various other prohibitions under that law might be unconstitutional. It's just not, it depends on how a court would end up defining a law that is calculated to punish wrongdoing in the healthcare industry, whether or not the actual substantive provisions of the pill mill law would fall under that exemption. What does seem clear is that any sort of administrative licensing scheme, any sort of regulation of healthcare providers or health insurance would almost definitely not be exempted and therefore would be considered unconstitutional under Issue 3, because those laws are generally understood and those regulations as not being aimed at punishing wrongdoing or deterring fraud, but rather at maintaining certain quality standards within a profession.
So let me give you an example of that. A few years ago, physician's assistants were given the authority to write prescriptions in the state of Ohio. We were one of the last states to add that to their scope of practice. If a new health profession or an expansion of the or reduction in the scope of practice of one of our health professions were desirable in the future, that wouldn't be something that would be described as punishing wrongdoing or deterring fraud, and you couldn't make that change according to this law.
And finally, I just want to point out something strange about the language here, and again, it might be helpful to actually look at Section 21D. The entire constitutional amendment, proposed constitutional amendment, talks about federal, state, or local laws or rules. And then when you get to this Section 21D, which exempts certain things, it says laws or rules in effect as of March 2010. And then when you get to the deter fraud or punish wrongdoing, it just says affect any laws calculated to deter fraud or punish wrongdoing. So it's exempting laws aimed at those purposes, but not apparently rules. And it's unclear, again, whether this was an intentional way of drafting this or it's just sloppy drafting, but one might infer, a court might decide based on that agency rules intended to deter fraud or punish wrongdoing are not exempt, whereas laws, legislative enactments of the state legislature, for example, would be exempt. Agencies themselves would still be powerless under this amendment to adopt any rules or regulations aimed at, even if they're aimed at deterring fraud or punishing wrongdoing.